Hey guys, we're here to present our community health presentation on forensic nursing. Lisa's going to tell us a little bit about forensic nursing and what all that entails.
Hello. Forensic nursing is one of the newest specialties areas recognized by the American Nurses Association. In 1992, 72 registered nurses, mostly sexual assault examiners, came together to form the International Association of Forensic Nurses. Nurses who apply concepts, strategies, and interventions to victims of violent crimes, and perpetrators of criminal acts fall within the dynamic field of practice. As their responsibilities evolve, forensic nurses are assuming increasingly diverse roles in risk management, employee litigation, forensic nurse investigator, forensic nurse educator, bioterrorism, domestic and international investigations of human rights, and emergency room forensic and pediatric nursing. Now we're going to have Kim tell us a little bit about the specialties of forensic nurses.
First of all, education is Associates in Science in Nursing, the ASN, Bachelor's of Science in Nursing, the BSN, or a Master's of Science in Nursing, Forensic Nursing specifically. The length of time depends on the course you take to get some of those baseline nursing degrees. Specialties and certificates, some can take as little as 45 hours, 60 hours, and there are some that are in the 400 hours depending on what specialty you go into. The ones that are included are death investigators, legal nurse consultants, the SANE, which are the sexual assault nurse examiners, advocates, forensic nurse hospital-based experts, risk management, and forensic mental health consultant. Again, years of experience. It's based on the individual and the track that was taken to receive the nursing degree. Once licensed, they must achieve expert skills in detail orientation, critical thinking, compassion, patience, and communication. The fields of responsibility for the forensic nurse cover a wide variety of areas to include violence, abuse, exploitation, neglect, victimization, crime, trauma, and accidents, and that's just to name a few. Professional organizations, there's basically one main one, it's the largest one. It's the International Association of Forensic Nurses, the IFAN is what they call it. Also, you can receive credentialing through the IFAN as well as the American Nurses Credentialing Center, which credentials nurses from all areas of the spectrum. Health promotion focus in the communities is abuse prevention, abuse protection programs, community awareness programs, and rehabilitation programs. Their focus of quality care is patient safety, compassion, critical thinking, attention to detail, and evidence collection, which is probably one of their most important focuses. Kelly is going to talk about some intriguing information that we found during our research, and I'll let her take over now. Thank you.
Hey guys, as most of us know, we're nurses and we may actually have experience with sexual assault victims. Some intriguing things that we've learned during this research that we weren't aware of as emergency room nurses is that if a patient arrives and has been thought to have been sexually assaulted and they are unable to consent, there can be no sexual assault kit performed unless a consent is given by the patient. Next of kin cannot consent at all. It has to be by the patient or they will not perform the sexual assault kit. This is a breach in privacy and they stick by it. In 2007, you could not come to the hospital without getting an exam, without filing a police report. They decided to go ahead and throw that law out and make it to where if you arrived at the hospital and were complaining of a sexual assault, they would let you go ahead and be examined and have a sexual assault kit performed, and then hold the evidence in case you were to change your mind at a later date, which they found happened more often. Every ER can now examine a sexual assault patient, to where before it was only certain ERs and certain locations that you could go to. In 2010, SAFE, the sexual assault forensic examiners, would actually start coming to the hospital. So if you have a sexual assault victim come to your hospital, they no longer have to leave under police protection and go to a different facility. This assists with time, privacy for the patient. They provide clothes, medications, Plan B if necessary, and it happens to be a lot better for the patient in the long run. Some things that you might want to consider as a nurse if you were to have a sexual assault victim is if the patient happens to show up with anything that's evidence, you would want to package it in a brown bag. If the patient voids, you would want to collect their first urine in a cup, a sterile specimen cup, and place that in the brown bag. Along with, if you happen to think it's an oral assault, you could swab the patient's mouth with culture swabs and place that in the brown bag. One of the most important things with these sexual assault victims is the evidence that will help them later on in their cases. And that concludes our community health forensic nurse presentation.